How can you tell if you need a deep cleaning or a regular cleaning as a patient? In case you don't know me, I'm just a dentist, and today I get this question all the time, and people have asked me ever since I put a video out there about how not to get scanned, because a lot of dentists are starting to push the deep cleanings, which are more expensive, there's more perio maintenance, and everybody's asking me why you need a regular cleaning versus a deep cleaning, so here you go. By the way, if you don't know what a deep cleaning is, it's where we clean below the gums and we clean all the bacteria out. It's a little bit more extensive, it's more expensive. Sometimes we have to get you numb because it's a little bit more sensitive than a regular cleaning, but basically deep cleanings are 3 to 4 times the cost of a regular cleaning, so everybody wants to know, why can't I just do a regular cleaning? So here you go. Regular cleanings and deep cleanings are differentiated based on pocket depth. Now, pocket depth is determined by a perio probe. I know it's a weird name, but somebody had to name the instrument a periodontal probe. Now, a periodontal probe looks like this, and basically you're going around the gums, you're measuring the distance between the gums and where the bone height attachment is. So it gets a little bit complicated. Essentially, to make it easy, you go by these numbers. So we're shouting out numbers to our hygienist. We're shouting out 3s, 2s, or 1s in no order. 3s, 2s, or 1s are healthy, and 4s and 5s are a little bit unhealthy, and 5s and aboves means that you need a deep cleaning in that quadrant. So for example, we're going around there are 6 different points that we're going around each tooth, and we're determining, is there any bone loss? Now, if you have bone loss, you're gonna go from maybe a 2 to a 5 or a 6 reading, which means that you have a pocket depth that is 6 millimeters long. That means that you have lost an attachment of approximately 3 to 4 millimeters. Now, what that means is you've lost a little bit of bone, and when you lose bone, you lose gum tissue, and when you lose gum tissue, then you have signs of periodontal disease and or gum disease. The progression of the bone loss is what we're trying to relieve you of by doing those deep cleanings. Now, when you go to get a deep cleaning, the reason it's so much more expensive is because we charge per quadrant. So if you have 4 quadrants in your mouth, we're gonna charge you a fee per quadrant. Let's say you only need 2 quadrants of SRP, which stands for scaling and root planing, but the reason you do 2 quadrants instead of 4 is because you may only have disease or have pockets that are on those 2 quadrants. The other 2 quadrants may be totally healthy. So you may just have to do a periodontal maintenance program after that to keep up with those. And a lot of times when we do scaling and root planing, which is part of the deep cleaning, we are going to do a 3 to 4 week checkup after that to make sure that your cleaning is doing what we thought it would. So you should see a little bit of recovery, or at least a stoppage in the progression of the periodontal disease or the bone loss once we do that. Let's talk about the regular cleaning. Now, a regular cleaning is what most of my patients have, and most patients have in the practice. So maybe 50 to 75% of patients in general in every dental practice have to do a regular cleaning. Now, regular cleaning is just where we're cleaning from the gums above. So we're cleaning above the gums, maybe a little bit in the sulcus of those pockets. Remember, a healthy pocket is 2 to 3 millimeters, maybe 1 millimeter. We're scooping down underneath the gum, but most of the cleaning is basically a surface polish. We're cleaning in between the teeth, we're cleaning above the teeth and above the gum line. Generally, regular cleanings cost way less than do deep cleanings, so a lot of patients prefer to have those, and a lot of patients will ask me, doctor, can I just do a regular cleaning? Once you are on a deep cleaning and periodontal maintenance program, based on the insurance and based on our education, we will tell you that you are kind of stuck on that track. You can't go back to a regular cleaning, and that's because once you have bone loss, that bone loss never gets rebuilt, and then we have no way of getting it back. So for example, if you have a 7 millimeter pocket on your tooth, which means that the bone in one area or multiple areas has shrunk down 7 millimeters, and you've lost maybe 4 millimeters of bone, you can't go back. So essentially, you can't go from a patient that has been diagnosed with needing a deep cleaning back to a regular cleaning, which is kind of a bummer, because once you stop that progression, you could maintain that 7 millimeter pocket the rest of your life, but patients cannot go from a deep cleaning to a regular cleaning. The regular cleanings also are less expensive and better covered by insurances. A lot of times the deep cleanings aren't covered by insurance at a rate that we want them to. I think they should be covered 100%, but a lot of times they aren't. The regular cleanings are also in a frequency of every 6 months. So you're coming in every 6 months, you're getting x-rays once a year, you're getting an exam either every year or every 6 months. And so when you come in, it's fairly routine, and the time of a regular cleaning is about an hour. Now, if you do a deep cleaning, we could do maybe 30 minutes for 1 quadrant, maybe in an hour and a half, we can probably do 2 quadrants of the cleaning. And then when we do the periodontal maintenance cleaning, it is a 1 hour procedure, and we're going to do that over every 3 to 4 months. So it is a more frequent procedure, and a lot of times dental insurance won't cover more than 1 or 2 or 3 periodontal maintenance sessions per year. So let's say you're coming in and you need a bunch of perio maintenance, it's not going to be covered a lot of times compared to a regular cleaning. My hygienist used an instrument, I forget what it's called. It's not the ultrasonic, it's the Cavitron. Anyways, she has a little sprayer that she uses and it just blasts on your teeth, and she uses that, and that does a really good job above the gums, but it doesn't do anything below the gums. So when you do a deep cleaning, we're gonna clean below the gums with hand instruments. Sometimes people use lasers. If it gets really progressive and bad, we're gonna have you go see a periodontist, which is a gum specialist. Now those gum specialists could use lasers. They have specialized hygienists that do deep cleanings on patients, and they can do surgery. So they basically open your gums up, do the surgery, stitch the gums back, and they do a periodontal surgery. If it gets so progressive, or we start to see a decline where your periodontal health or your bone loss gets from, let's say, a 7mm, 8mm, 9mm pocket, you're gonna wanna go see the specialist, because that specialist is going to get you back on track and stop that progression. The worst thing that can happen on these deep cleanings is that you ignore them and you don't do them, because what's gonna happen is if you have loose and wiggly teeth or a change in your bite, where you have a lot of inflammation, that can really take over, and you want to halt that progression. Again, we can't build it back, but you want to halt the progression so that it doesn't get worse. That's why these deep cleanings are so critical that you take these serious. And yes, they're expensive, and no, insurance doesn't cover this 100%, but it's very, very detrimental if you don't do it. Now, if you skip like a regular cleaning, really the end of the world, but I wouldn't go more than a year without getting a cleaning, because that's just kind of gross, because at that time, you can't clean every nook and cranny of all your teeth, and your plaque is going to harden up and turn like calculus, and the calculus, you at home cannot get it off. We have power tools and we have ways of getting that off at the dental office, so it is a much different ballgame. So hopefully this video helped you a little bit. I know I've been getting a lot of questions on like, hey, why do I need a deep cleaning? Why do I have to pay for a deep cleaning? Am I being scammed by my dentist? I made videos of that where some dentists are actually pushing the agenda of the deep cleanings just simply because they get paid more money. So a lot of patients have been asking me this in the meantime, so I thought I'd make a video of it. I hope you guys enjoyed watching this. Like, subscribe, do all that kind of stuff so I can spread these videos to everybody around the world. I'm just a dentist, and thanks for watching.